Shri Vinekar, consultant obstetrician at Cloudnine, Malleshwaram, and let's discuss about the right sleeping posture in pregnancy today. In the previous video, we had already discussed about why sleeplessness happens in pregnancy and how to tackle it. Today, let's look into what is the right sleeping posture. So traditionally, it was believed that sleeping on the left side is beneficial in pregnancy. So before getting deeper into it, let's understand a little bit of anatomy and physiology of the human body, especially in pregnancy. As we all know, heart pumps oxygenated blood to the rest of the body, and the deoxygenated blood is sent back to the heart. Now, there is a descending aorta which collects this oxygenated blood from the heart and supplies to the lower half of our body, including the womb. Now, the return of the blood happens through inferior vena cava and deoxygenated blood goes to the heart. Now, both this descending aorta and the vena cava run parallelly just in front of our backbone. So, when the pregnant womb starts increasing in size, and if the woman lies flat on her back, there is a possibility that this pregnant womb can put pressure on these blood vessels at the aorta and vena cava and can reduce the blood supply to the growing womb and the lower part of legs. That is why traditionally it is recommended that the woman actually sleeps on her sides. Now, why left side? That is because the inferior vena cava runs on the right. Typically, veins get compressed more easily than the artery. And hence, when you sleep on the right side, there's higher chance of your inferior vena cava getting compressed. That is why it's traditionally told that we should sleep on the left side so that the blood flow to the womb and the lower part of our body is maintained and the return of the blood to the heart is also maintained. Let's start each trimester wise. The first trimester, that's the first, second and third month of pregnancy, the womb actually is inside the pelvic cavity. It's not even come out. It comes out of the pelvic cavity in the fourth month. As a result, it's nicely protected in the pelvic cavity and doesn't get compressed. So you can adopt any sleeping posture that you're comfortable in the first 3 months. It really doesn't matter. So much so that you can even lie on your stomach in the first 3 months as long as you're comfortable. But the challenge remains that because the uterus is growing inside the pelvis, it causes a lot of pressure on the backbone, so you'll end up having tailbone pain. And the second is because of the breast tenderness, sometimes you may find it difficult to lie on your stomach. Otherwise, it really doesn't matter which posture you adopt in the first 3 months. Now, let's look into the second trimester, which is the 4th, 5th and 6th month of pregnancy. Even here, the height of the womb is actually lesser than your belly button. And the aorta and vena cava can get pressed only when the womb is above the belly button. So technically, even in the 4th, 5th and 6th month, you can adopt any comfortable sleeping position without worrying about reducing the blood supply. But the key here is because of the growing uterus, you will start experiencing low backache more over here than in the first trimester. And hence it's advisable and it's better to get into the practice of sleeping on the left or right side. Left or right side. It doesn't have to be only left side. You don't have to panic if you find yourself waking up lying on the back. In fact, I have patients coming to my outpatient very worried that they find themselves lying on the back in the middle of the night, whichever side you are comfortable, because it's not practical to sleep on the same side the whole night. You'll wake up getting some leg cramps on the left side or the cramps in the arms. So make sure you take turns, left or right side. Another easy way I keep telling my patients is to support your back when you're sleeping. Either use the back of a wall to support your back so that you don't inadvertently turn, or use a nice pillow to support your back. Keep your legs folded and hug up. Put a pillow between your legs so that you're comfortable. You can even use a small wedge pillow to keep it under your womb so that you're comfortably sleeping. Another suggestion I usually make is, because nowadays most of the bed is in the middle of the room, I always say use your husband's back to support your back. That may be another practical suggestion. Now let's look into third trimester. This is the challenging phase because here the womb is gradually growing up to the level of your chest. So this growing womb will put a pressure all over your abdomen. Obviously, it's going to put a pressure on the blood vessels, the aorta and the vena cava, and it's going to push your lungs up, so you're going to find yourself a little more breathless in the night. So obviously, sleeping on the back is absolutely not practical. You may find it even difficult because when you sleep on your back, you're going to find yourself quite breathless. And hence, sleeping on the side will really help over here because your womb is moving away from the abdominal organs. You'll get a little more space. To some extent, even helps putting 1 or 2 pillows below your head so that you prop up yourself so that you can breathe better. So when you lie down like this on the left or right side, you're relieving the pressure away from the aorta. Aorta is what's giving blood to the lower part of our body and to the womb and making sure there's a good blood supply. Secondly, when you move the womb away from the vena cava, the return to heart is maintained. Otherwise, what will happen if you put a pressure on the vena cava? There is going to be pooling of blood in the lower part of your body in the veins. So it can result in more swelling of your feet. That's exactly why it's preferable to sleep on your left or your right side. In between, you can take turns. And there is also a myth that when you have to turn from one side to another, there are people who believe that you'll have to get up, sit and then turn. Because there's a myth that if you roll over and turn from one side to another, the umbilical cord of the baby can go around the baby's neck and all. There is no truth in this. It doesn't matter. You can just roll over from one side to another. You don't have to do all this gymnastic of getting up and lying to the other side. Now that you actually need more good night's sleep, you will find it harder to sleep thanks to the growing bum, the breathlessness and the backache. You have to find a comfortable posture in a comfortable bed with comfortable lighting in a comfortable room and find yourself with a lot of pillows around you to hug, to support your back and have a good night's sleep. And for more such videos to enlighten about pregnancy, do subscribe to our channel.